All right, it's easy to assume that we've all been celebrating the mild weather, the early tastes of fall. However, there is a drawback to the end of summer fun in fall allergies. So if you count yourself among the afflicted, you know the sniffles, the scratchy eyes, those kind of start to take over your days here pretty soon. But they don't have to. So joining me today in this sponsored segment, we have Drs. Roger Friedman and Basil Kahwash, both allergists and immunologists with Ohio ENT and allergy physicians. Good to see you guys.
Hi, Robin. Great to see you.
All right, Dr. Friedman, let's talk about fall allergies. I was just telling you the afflicted in my house. But what exactly are we seeing? What's causing them?
What's going on right now, Robin, this time of year in particular is our busiest season.
Yeah.
This is when we have ragweed pollen allergies. We oftentimes call it hay fever, although it has nothing to do with hay and nothing to do with fever.
Yeah.
But it's ragweed pollenosis. And this has been a particularly severe season because we had lots of rain early and things have been growing and blooming and pollinating. And now we've had this beautiful weather that's gone on for a week, 10 days, and all the pollen's in the air and causing all of these terrible symptoms for our patients.
Yeah, and the symptoms are what? Are we seeing a lot of scratchy eyes?
Scratchy eyes, runny nose, sneezing, coughing, difficulty breathing, some asthma symptoms, all the typical things we unfortunately see virtually every fall for those unprepared.
Okay, those unprepared. So let's talk about managing that. When you're talking about ragweed specifically, are there ways that you can kind of quell those outbreaks, those flare-ups?
Absolutely. So as Dr. Friedman just mentioned, we've had this flare-up of ragweed pollen. Ragweed is an invasive species. There's more of it now than there used to be in Central Ohio.
Beautiful. We love that, right? Yeah.
Right. Yeah. So what does that mean for us? It means that you don't have to completely avoid going outside, but you may want to limit certain outdoor exposures if you don't have to. Close the windows, turn on the AC, turn on the fans, things like that inside the home.
Okay.
You can also, of course, manage medically. There are many great medical treatment options for managing ragweed allergy. Those include your over-the-counter antihistamines, which we'll talk about some of those, of course, later in the show, I know. Nasal sprays, as recommended by your doctor. And for patients who are severe ragweed allergy sufferers, there are options of ragweed immunotherapy, most commonly in the form of allergy shots to make somebody less allergic and less sensitive to the ragweed.
Yeah, and as we talk about those, do you always want to try first on your own an over-the-counter option, or is that like the smart thing to go get tested and find out before you kind of take it into your own hands?
Well, of course, I'm never going to discourage anybody from getting tested and finding out
exactly what's causing it.
Exactly what's causing their symptoms and if they're truly allergic. But it'll also help your doctor if you tell them, yeah, I tried this thing over the counter and it either helped or it didn't help. That often helps us guide people in the right direction as far as which kind of treatment is going to work out best for them.
Okay, perfect. And I know that, Dr. Friedman, you have a new treatment for anaphylaxis, and I think this is interesting. It's constantly innovative. I remember when you told me about the peanut allergy and the treatments that you guys had, that a lot of people don't always realize, I guess, how far we've come. So tell us about the Neffy nasal spray.
There's a new nose spray, new treatment for acute anaphylaxis. Up until now, we've had two really great products. I mean, for decades and decades. We have the classic EpiPen or generic EpiPens, and then we had the newer AviQ. AviQ was very clever because it was smaller, easy, more portable, and it talked to you. Less mistakes were made with it. You couldn't jab yourself like you could sometimes with the EpiPen. But now we've taken it to another level where we have a new drug called Neffy, and that stands for nasal epinephrine. And it's a very, very excellent product for those patients who are a bit needle phobic. The ones who are scared to use a needle and who maybe won't use a needle. That's one thing that Basil and I have run into all the years. People who needed to use epinephrine but were scared to and didn't do it because it was a shot, whereas they're more comfortable doing it with a nasal spray. We're still trying to accumulate enough data and science to say, will it work in everyone as well? But it does look like it works really well in the majority of people, and it certainly can be a good additive treatment that we have for our patients.
And isn't that better than doing nothing? If you're afraid of needles and you're doing nothing, right, is that not the hope, right?
Certainly, yeah. In a life-threatening situation, if it's really critical, timing can be really critical. Timing is key. The sooner you get epinephrine into the body during an anaphylactic reaction, the better off the patient's outcome is going to be. Study after study has shown that. So in somebody who's hesitant or is not properly trained on how to inject themselves with epinephrine, having the option of giving themselves epinephrine through a nasal spray is really a revolutionary way of treating an anaphylactic reaction.
And although, this is obviously people are worried it's a severe life-threatening disease,
Sure.
but it's the same mechanism that we use for drugs like Narcan to save our lives from drug overdoses. So it's not a new technology.
Yeah, the
technology we're
technology's
used to using.
tested and tried and tested, and it's obviously working. So when we talk to about allergies and somebody finds out, we often hear all the different names, even Benadryl, and you're doing, Zyrtec and all that. Are those still the go-to? Are there things out there that people should try?
With regards to oral antihistamines, so allergy pills that somebody's taking on a day-to-day basis, these days we really discourage people from using Benadryl in that way.
Okay.
Benadryl's been around for a long time, of course, and a lot of people, it's probably the most commonly tried allergy medication out there. Having said that, there are newer and safer allergy medications for somebody to use on a day-to-day basis. And a lot of allergists now are putting out more editorial pieces, opinion pieces, really advocating for using the newer, safer second-generation antihistamines like cetirizine, commonly known as Zyrtec, or like fexofenadine, commonly known as Allegra, things like that that are available over the counter but don't have as many of the short-term and long-term side effects that Benadryl does.
Okay, perfect. I was just saying, my son and my husband, we're all on Zyrtec. Like the whole family has it. So I mean, this is important stuff. And I want to end just real quick because I know there's a new injectable as well with severe food allergies, Dr. Kahwash, and I want you to just mention this because a lot of people face this, right?
Absolutely. So the injectable that is now approved for treating severe food allergies, it's a once-a-month shot. It's called Xolair. Omalizumab is the generic name for it. And basically the way that it works is it almost acts as like a buffer between the exposure to the food allergy and the anaphylactic reaction. So the person who has this circulating Xolair in their body that has come in and gotten these shots, you're less likely to have an anaphylactic reaction, a serious life-threatening allergic reaction to the food that you're allergic to if you were to be accidentally exposed to it or accidentally eat it.
Okay, that could be very beneficial.
The best analogy I like to use is that when using Xolair, it's like giving your patient a seatbelt and airbags.
Yep.
There
so
you go.
You maybe can't prevent a crash, but you can prevent them from being hurt as badly.
Right.
Perfect. All right. Well, I want you to go back to Dr. Kahwash saying that everybody should go get tested and at least know what they're allergic to first. You could do that at Ohio ENT and Allergy Physicians. Thank you guys for being here.
Thanks, Robin.
Thank you for having us.